Hello, everyone. Welcome. Welcome to your interview day welcome talk. Usually, when it's not COVID, you would be upstairs in a boardroom listening to me talk for an hour. But unfortunately, you can't be here today, and so we've decided to do something fun and creative. I'll be your host for today. My name is Dr. Somil Parikh, and I am the program director here at NYPQ. And I'd like to introduce to you Nao Yoneda, who is our associate program director.
Pleasure to be here, Somil.
Thank you. Thank you very much. So we're going to do something fun today, Nao. Let me tell you about it.
What are we doing?
We're going to do something called the Hot Wing Challenge. So progressively, through every round of this, we're going to meet more and more faculty members and more residents. And each round, we're going to eat progressively hotter and hotter and spicier buffalo wings. Are you ready for the challenge?
I am ready.
Okay.
Are you ready?
You're
eating all the wings and all the hot sauces.
I'm brown and I can handle the spice, I think.
So bring it.
But I will probably sweat a little, but we will get through this.
Let's do it.
So I guess without further ado, we should actually get our first samples here. Wow, thank you very much.
Thank you, Kevin. You are a doll.
Wow. Okay, so these hopefully are on the milder side, correct? Okay, so I'm gonna have you start while I start the talk, and then I will start eating a little bit later. Okay?
I'm going for it.
Yeah. Okay. So NYPQ and our emergency medicine residency. Why should you come here? So typically I would give you a talk and just say all the things that are listed on this slide, that yes, we see a lot of patients, and yes, we have a great catchment area, and yes, I'm going to show you the ICU and our trauma bay, and unfortunately none of that's going to happen today, so we're going to have to be creative with what we have. So why come to New York Presbyterian Queens? Probably one of the most important things is because you want to join our family. And that's exactly what we are here. We are more than a training program. We are more than a place of work. We are a family of colleagues, residents, and really close-knit individuals. Nao, you were a resident here, correct? Finish your wing, yeah. You were a resident here, and you graduated, I believe, in 2014? So tell us a little bit about the history of our residency program.
It would be my pleasure. I didn't time this right because I was just So our residency actually was originated in 2004. That means that we graduated 14, am I doing math right? 14 classes. And in total, if you consider residents and fellows, we have graduated 150 emergency medicine doctors.
Oh,
We've
wow.
all gone on to do really amazing things, and I couldn't be prouder.
Wow, excellent. That is, so we are not a new program by any means, and we are continuously growing and growing more every day. Correct?
That says that we're pretty established in the game.
So were we always NYPQ? We have gone by many different names, correct?
We've gone through a few different names. The hospital, I think the old timers refer to us as Booth Memorial. So if I have an older patient, like the World War II vets who come in, I always say Booth Memorial. Our residency program was originally known as New York Hospital Queens, and now we're New York Presbyterian Queens. I think the one established part of that name is Queens.
Very
we
nice.
rep Queens.
Yes, I think
the best borough.
We became NYP, I believe, in 2015 or 2016. And since then, we've had a much closer affiliation with a lot of the other NYP programs in New York. So I put up a few slides here. As you can see, over the years, we have really developed this network of amazing individuals. Obviously, you can see some pictures from way back when, and obviously, you can tell by the masks that some of them are more recent, during the era of COVID. But nonetheless, we have alumni scattered throughout the world that are part of our family and will always be a part of our family.
I didn't know there were going to be photos. Makes me nostalgic. Very nice.
So why this program? Why choose this program to come and train here? So number one, we're fully accredited by the ACGME. We are a 1, 2, 3 year EM format. We are not a 4-year program. We are a level 1 trauma center. We are a STEMI center as well as a comprehensive stroke center. We are an affiliate of Weill Cornell Medical School. and part of the New York Presbyterian Hospital System. Which, by the way, I don't know if you know, but on U.S. News and World Report's 2020-2021 Best Hospitals edition, NYP, the system, was 4th in the nation.
I did not know that.
And the
Thank
year
you
before,
for sharing that knowledge.
And the year before that, we were 5. So we're moving on up.
Number 1.
To these
That's the goal.
And another reason that this place is nice is most of all your rotations are here. We're not a multi-site center where we're shipping you from site to site to site. For the most part, 95% of your training is done here at this hospital in Flushing, at this site. We are a large tertiary hospital with great ancillary services. We have great nurses. We have great support staff overall. Okay, and so for all of these reasons, that's Omar Halal up there, who just begged me to be in the PowerPoint, and therefore I obliged, even though he has a mustache. To give him credit,
That's a great photo.
To give him credit, it was the month
finest.
of November, and so he decided to grow this awful thing on his face.
He was doing it for a good cause.
Yeah, he was doing it for a good cause. But anyway, that's Omar Halal.
I'm glad it's gone now.
He's yeah.
I'm just kidding, Omar. I love it.
He's a third year and looking for a job currently. So, why else this program?
I'm already sold. Sign me up.
So one of the reasons you need to come here is the way we learn here, right? So the way we learn here is really designed for the new age learner. The new age learner essentially being the millennial learner, but I was told I shouldn't use that word. So for the new age learner, our teaching here and our learning methods are highly interactive, highly immersive. Everything is hands-on and kinesthetic. So you learn by actually immersing yourself in the scenario, in the case. And so whether it's in the sim lab, which we'll talk about a little bit later, or whether it's scanning on your ultrasound shifts, or whether it's small group didactics with flipped classroom method, or in the cadaver lab. We actually go to a cadaver lab at NYCOM twice a year. Or we do a lot of learning through in the digital realm, through blogs and podcasts and social media. And we also do something that's highly interactive called Foundations in Emergency Medicine, which I think you're going to talk about a little bit later. But bottom line is we are a residency program that utilizes new modalities to learn. Why else this program? There is plenty of core faculty here to mentor you in research opportunities, so there are plenty of opportunities for you to engage in scholarly activity. We have a lot of international opportunities for you to do some global health work and international emergency medicine. We have 4 fellowships here as well. Can you tell me what the 4 fellowships are, Neo? Because you're one of the directors of one of them, correct?
Yeah, so we have 4 fellowships. Am I awkwardly holding this plate? I was gonna put it down, but I didn't. Thank you, Kevin. In the back of my head, I was thinking
very good wing.
Your turn to eat. I didn't think it was bad. A little glistening.
But they're gonna get hotter, so I better brace myself.
So we have 4 fellowships. To get back to your question, one is the administrative fellowship, one is the ultrasound fellowship. One is the simulation fellowship, and our newer fellowship, the medical education fellowship. I have the pleasure of being the director of that fellowship, and great. We started it with the hopes that it would really enrich the academic landscape here, and I feel like it's been really fantastic. It's really added a lot to the program and the educational experience, and I love the fellows collaborating with one another, and it's been wonderful.
That's amazing. Fellowships here are great. Fellowships obviously add a new dimension to your learning, and they've really augmented kind of the academic environment of our program. So thank you for sharing that. So these are all reasons for you to come to our program, but probably the most important reason to come to our program is the patients. So let's talk about the patients. The patients are from a very diverse background. Okay, so many program directors on your interview trail will tell you that they serve a very diverse patient population. I think sometimes that diversity gets conflated with the treatment of minorities. Whereas here, diversity truly means diversity. We speak over 130 different languages here. They come from all walks of life. And with that, diversity comes a ton of acuity, right? So if you are to take out urgent care and peds, from the patient mix, from our main ED, we admit 36 to 38% of our patients. So that's almost, a little over 1/3 of the patients get admitted to the hospital. So they're pretty sick. If you add peds and urgent care back in, that's about 22%. So basically 1 out of every 5 people coming through these doors get admitted to the hospital, and about 1.8% admission rate to one of the ICUs. So a pretty sick patient population. I think one of the reasons is because some of our patients really don't have access to healthcare, and so when they come in very, very sick. And many of our Asian patients, for example, they come in at the very, very end of their illness because they generally are at home, very stoic, and they try a lot of Eastern medications and herbal medications, and then when they show up at your doorstep, they're actually profoundly ill. So bad for them.
There's a lot of truth to that.
Bad for them, but
attest.
I know, right? So do you know how many times a resident will be like, oh yeah, there's this 85-year-old Korean man with abdominal pain, and I'm gonna give him a GI cocktail and send him home. And I'm like, no, you're not, because he's gonna try and die in the next hour. So you learn that.
Timer.
You learn that here at New York Presbyterian Queens. So yes, you need to come here for the patient diversity, the high acuity. As I mentioned before, we're a trauma center, stroke center, and a primary STEMI receiving center. We are the only primary emergency medicine residency program in Queens. That where the central location is Queens. Yes, we have Mount Sinai Hospital that actually sends sends residents to Elmhurst, but they are primarily based in Manhattan. So we are the premier EM program in Queens. We're also the receiving hospital for many venues nearby, including Citi Field, the National Tennis Center where the U.S. Open is played, as well as LaGuardia Airport, and even we get patients from JFK. And you'll be surprised to see and learn from the patients that come directly off of planes into our shop. And so these are patients that are, we've all seen here at NYPQ. The pathology and the acuity is absolutely amazing. And so that's why you need to pick this place. It's the patients, the patients, the patients. And let me tell you, I don't think that this is an understatement or any degree of hyperbole here. We really just have the nicest patients that you can imagine. They wait patiently. They are very happy to receive good medical care that we provide. And they're just all around great patients to care for.
I feel like it's fulfilling to work here, and it never gets boring, in other words.
Right? I've worked at like 7 different EDs, and the patients here by far are hands down some of the best patients you'll ever work with. So why else this program? Because we're kind of a hybrid of all the types of programs out there, right? So like on one end of the spectrum, you have that county feel, right? The kind of the inner city, patient population that may be underserved, underprivileged, they may be uninsured, and they use the ED primarily as their primary care. But then on the other end of the spectrum, maybe out in the suburbs, you've got community hospitals where everybody's well connected. They have PMDs and well insured, and we are kind of in the middle. We have both ends of the spectrum. You will take care of homeless people here, but you'll also take care of patients who are well established with PMDs, and we will actively engage those PMDs in the patient's care. So we're kind of you'll see a wide variety of different patients in that regard. And once again, I'm just going to repeat, we have some of the nicest patients, and they're just great patients to take care of. Where do we fit in the whole grand scheme of urban versus suburban? So we are a urban program. We are not in the heart of downtown Manhattan, but we are in New York City. We are in the center of Queens, and so definitely not rural. And as you go more out towards the east side into Long Island, that's more of the suburban programs. So we would classify ourselves as more of an urban residency training program. And of course, why else this program? We are in New York City, which is the best city in the whole wide world. And if you disagree, you're wrong. That's just plain and simple.
Hands down.
And also we are a hybrid in the sense that we are an academic center. We are affiliated with Cornell Medical School. We have many ACGME accredited programs here. Primary programs here are surgery, EM, and IM. But then all the other residencies come from Cornell, like GYN, and ortho comes from Hospital Special Services. Pediatrics comes from Cornell, etc. And so we're a hybrid between community and academic as well. So let's talk for a little bit about kind of the clinical learning environment, right? So ACGME always asks us yearly, what are we doing, in terms of the clinical learning environment to optimize learning for residents on shift? So, can you tell me a few things that we do in terms of on shift, of how we teach and how we make learning more tangible on shift?
I would love to address that. Kevin, hot sauce maestro, can I also have some more wings? I'm starving. And make it hotter. So when we consider our clinical learning environment, I feel like the best aspects of what we do here are that teaching happens bedside. So on shift, we try to get in there as much as possible and incorporate that. Teaching happens during shift sign out, during shift board rounds, in addition to morning report, which is a nice, brief, short and sweet activity that we do on a regular, and that's just supposed to give you some juicy educational pearls to walk away with for that day. And we also have, thank you kindly.
Oh, wow.
And then when I'm awkwardly holding my plate, I'll give it to you again.
And I think I'm done as well.
Now you only have 20 or so
yes,
more to
I'm
go.
gonna just stick to these round because I have a lot more to do. But
Fair enough. We also have the Raymer rotation. That's a senior rotation that is 2 weeks, and that stands for research and medical education. That is a very nice time for the residents to really concentrate on trying to hone their skills as an educator.
Gotcha.
It's something that we started maybe a year or two ago. And it also gives residents an opportunity to try to work on the research projects. And that's a good 2 weeks where you don't have any shifts and you can just concentrate on that, work with the students, work with the junior residents. And
that's excellent.
yeah, it's neat.
So I know also that they try to go around the ED and actually pick out active patients that have good physical exam findings and
Right.
good. So
Yeah.
that's a great way to learn on shift, and especially for the students as well. That's great. What about when residents have, to tap a knee or to do a chest tube? Do they have time to drop everything they're doing and focus on their procedures? That one's a hot one, isn't it?
Is this the bomb? Was it the bomb?
Yes.
Okay. All
God,
right.
I'm
I
already
probably should have gone with that one first.
I'm already sweating. Can I get a napkin?
That's a lot of Scoville units in my mouth. Keep it together, Yoneda.
Okay, go ahead.
Yeah, absolutely. So I think that it is a priority for us on the core faculty to make sure that our residents are not giving up procedures.
Sorry.
I don't need a towel yet. I think I'm okay. And that their patients, when they require a critical care procedure, an exotic procedure, that's theirs. They have ownership over that activity. We do have consultants involved in the mix, which is true of any hospital. When we call them and we have them come and take part in patient care, it's hard to talk. I feel like I was awkward before, but now it's like my mouth is, I can't feel it. When said consultants come down and they're participating in the patient care, oftentimes they'll be there to help educate and help be involved and oversee, but we want our residents to have those procedures.
I will second that. I will definitely second that. I actually invite all my residents to let me know when they feel like they were not able to get a procedure in the ED, and I look into it right away. But procedural competency is something that is imperative to any EM residency, and so we make sure that our residents get the procedures, including things like arthrocentesis, that is done by the ED, including things like transvenous pacers, that is done by us, not cardiology, etc. So that's very good to know.
And whatever exotic procedures we feel like you may not see all the time, we supplement that with our annual cadaver lab or a lot of procedural simulation activities.
That's excellent.
That's on a regular.
That's excellent.
I have a little more dab, and I think I'm going to try to eat it soon, but I'm like waiting.
Can you tell me about scribes?
So the
You have
residents
scribes in your
are
ED? That's
the
great.
residents are able to utilize the services of scribes or CIMs, clinical information managers. The scribes are often aspiring medical students or PA students or basically they're interested in healthcare as well. And so they're part of the team. They really help your workflow. And we want you to be familiar with that for when you graduate, because I think it's a skill set unto itself to use the Sims to dictate your notes.
Right. Well, I mean, it is 2020, and let's be honest, most people, when they graduate, are going to go on to work in a place where you will have a third party, i.e. a scribe, dictate your notes. So I think it's a good skill. But our first years, for sure, do take a full year to write their own notes, and we give them a lot of training in how to document well, and all of that. So I will tell you that scribes, though, have probably are one of the biggest elements that have really kind of revolutionized our clinical learning environment, because our residents, nobody went to med school to write notes all day. They are seeing the patients, they're doing procedures, they're teaching, they're learning, they're having time to actually have conversations, and basically they have time to be a doctor, which is one of the most important things. So I
also don't want my residents, my trainees, to spend hours and hours after shift concentrating on their notes. They should go home and read.
Oh, right. And that's another huge thing. So that actually brings up to the last point, right? That last hour around 6 o'clock, if they're leaving at 7, they don't pick up new patients. That's their hour to dispo, call PMDs, wrap up, discharge, etc. And I think that's great, because then we essentially round right at 7 o'clock or whenever shift is ending, and within a half an hour, our residents are wrapping up and out the door. So that's excellent. So I think that's the end of the first round. How were the wings?
I think the wings are delicious. I think
How's your stomach, I should say?
I think that some of the attendings may not be as hardy as me. So
wow, calling them out already.
I'm gonna take my wing. I'm gonna step to the side,
Right.
and I'm gonna let our spice maestro.
Okay.
Replenish.
Our spice sommelier. Okay, and I think that's the end
And
of round
thank you for
one.
allowing me to participate.
You're welcome.
I may see you again.